Okay, so now we're going to show you how to use the adjustable headrest, and trust me, working with a table without an adjustable headrest has been a real pain in the bum for me for the last 16 years. So this is just brilliant to have an adjustable headrest. The beauty of this is, once again, that we can open up the anterior part of the neck, so we know how often these structures through here get short and tight, okay? And then obviously the tissues in the back get lengthened and loaded. So it's all about opening up as much as we can through here. So the beauty of this is just reach down here, support the actual headrest itself, and then slowly, gently lower it down. So I'm just going to put a little bit of extension there. You have to test your clients to make sure that they're comfortable in extension as well. All right, so if you're not testing them and they're obviously getting some bunching up in the back and then they might get some facet joint pain, then that's not ideal. So you need to test whether or not they can actually go into extension. So the beauty of having them in this position is, as I said, you're opening up the anterior. So if we're looking at the SCM or we're looking at scalene muscles, you can actually put them on, as I said, a little bit of a stretch. So I'm going to drop them down a little bit further, like so. Okay, and then we're going to just rotate her away. That means we've been able to open it up. We've got it on a little bit of extension now. So I'm going to use a little bit of the essentials here, which is the more slipperier of the creams Premax have. Now, you may need to just bring your client up a little bit so that you can, like so, open up the neck a little bit more, got a little bit of extension through here. So now we're just going to pick up the back of the SCM, so when we hit these scalene muscles, so we can just come through here and work into that tissue like so through rotation. And again, down at the back of the SCM and into that posterior scalenes, okay? So just challenging that tissue as we work through rotation. Now what we can also do is bring the head back over into more rotation. That softens off that tissue and then we can sink in a little bit further as well. Okay, and as I said, the beauty is we can drop them down a little bit more extension, so we can open up the neck even more. So now we've got even more extension. That way we can also come in and really open up this SCM as much as we can. So just picking it up, obviously working through the range of movement itself. So into rotation while it's in extension as well. Okay, but caution, make sure that they're comfortable in extension. So if they're not comfortable in extension, so don't put them in this position. The other thing is also, if they start to get dizzy or they don't feel well or nauseous, then take them out of that extension as well. So they're the only precautions that you need to have in this situation here. So just lifting the back of that SCM through rotation whilst in extension. Just brilliant, for especially a lot of those clients that find themselves in forward flexion for most of their life. Hey guys, if you're wanting to know more about the Athlegen products, especially the tables, and also whether they be the electrics or the portables, check out the Athlegen website at athlegen.com.au, and also you can also check out our website link below.